Yeah, hello and welcome to Wimpole Street Dental Clinic. My name is Christian Mill, and in the following small presentation we would like to show you one of our cases of the month here made in our clinic. So thank you very much for watching and we hope you enjoy the video.
Yeah, hello and welcome to our first adhesive case in the library, in the video library. And this is a case about a Maryland bridge to replace two congenitally missing lateral incisors. It's a very simple case. I'm very grateful for the help of Master Dental Technician Bastian Wagner from our dental laboratory in Munich at the time. And let's start with the treatment. You can see here upper jaw with two missing lateral incisors, and they have been congenitally missing. That means they have never been there from birth onwards and never developed. So the first job you always have to do is bring the rest of the teeth in proper position. You can do that with orthodontics, and if they're in proper position already, then you don't need to do anything. Of course, you can place implants, you can drill down the teeth for bridges as well, but of course, implants mean surgery, and sometimes in patients who are very young, implants would not be advisable, and then for bridges you have to drill down perfectly healthy teeth, and in the end, the costs for both implants and the conventional bridge will be much, much higher than for a simple and technically normally relatively easy Maryland bridge. So the first thing we do is that we adjust the gums. If you have a look at this situation here, you can see, I just go one slide back, these were the gums before and these are the gums afterwards. You just do that with a removable tray, and under local anesthetic you just take the top part of the gums and push it to the outside, thus creating a nice so-called pontic, so that the bridges can really go into the gums and it looks like a natural tooth. Then of course you take the color for the dental technician and prepare the teeth. You only remove 10% of the tooth structure, and then after the preparation you take an impression and the technician does a dental model from stone plaster. This is what you can see here as well. And then we have to adjust a little bit the pontic, which is done by the technician here, so that the tooth really fits perfectly into the gum situation. And you can see these are the final restorations done from zirconium dioxide, veneered with feldspathic ceramic, individually veneered. So very beautiful work in the end, I think. And this is the work from the palatal side. So you can see two wings are prepared for each tooth, one wing. We don't join them anymore except after heavy orthodontics. Then you can do that, but it's always better to have just one wing, so you realize when one bridge is de-cementing. And in case that happens, then you just can easily clean it and rebond it. The wing has to have a minimal thickness of 0.7 millimeter. You can see in this case we have 1 millimeter, so that's absolutely perfect. If it's less than 0.7, there's a risk of fracture. And you can see here the placement of the Maryland bridges directly on the day, bonded into the situation with a special adhesive cement. And you can see here the palatal aspect from the ceramic, and it looks very natural, very good. And if you have a smile, it looks okay. The color of the bridges is now a little bit darker because this is directly after placement. The picture has been taken directly after placement. During that time, during the placement, the teeth dehydrate a little bit and thus appear a little bit whiter. In a couple of hours, it will be exactly the same color. And on the right side, you can see the gum is still a bit red. This will adjust as well, just perfectly. Yeah, thank you very much for watching this case and wish you all the best. And please have a look at our other cases on our video library. Thank you very much.